Okay, good afternoon. So today we're going to deal with the skeletal system. We already finished one system now, the integumentary system, and we will deal with the skeletal system. And this, before dealing with the system, we're going to deal with the, as gross anatomy, we're going to deal with it as histology. So today we are back to histology, and then the 3 lecture afterwards will be about gross anatomy of bone and joints. So the skeletal system consists of 2 types of connective tissue, cartilage and bone. And this is to remind you, we had this slide before about connective tissue. So connective tissue is either embryonic connective tissue or mature connective tissue. We have studied them both, the embryonic, the mature. We have studied the connective tissue proper, remember, loose connective tissue, dense connective tissue. And we mentioned that there is another type of connective tissue, which is supporting connective tissue, is cartilage and bone. This is our interest today. The liquid connective tissue, the blood and lymph, we will deal with it in block 3. So today we are doing the supporting connective tissue, the cartilage and bone. Let me remind you, before we start with the cartilage, let me remind you of the properties of connective tissue. Connective tissue has cells and matrix. And you can see here, the cells are widely separated from each other. They might connect, but they are generally widely separated by an interstitial matrix, wide spaces. And the matrix contains fibers and chemical substances. So there are collagen fibers, there are elastic fibers, and there are reticular fibers. So this same plan is present in bone and cartilage. And as you will find, there are cells, there is a matrix, and there are fibers. And the change in the physical properties is because of the different chemicals that are present in the matrix, but the design is almost the same. So let's start with the cartilage. And the cartilage consists of cells, and these cells, remember we said that there are blast type of cells and site type of cells. So this is cartilage, that's why the cells are chondro. Chondro means cartilage, so chondroblasts. So they start as chondroblasts. These cells have the ability to divide and lay down matrix. So the chondroblasts divide, form more chondroblasts, lay down matrix until they become imprisoned in the matrix. And because this matrix is a jelly-like matrix, and so they become imprisoned in the matrix and in spaces or lakes, small lakes called lacunae. Lacuna means small lake, and so they become chondrocytes. When they are chondrocytes, they will lose the ability to divide. They will not be able to lay down more matrix, but they can't maintain the matrix. So we have chondroblasts and we have chondrocytes. And there is a matrix. The matrix consists of collagen and elastic fibers, and we will see that there are different amounts of collagen and elastic fibers in different types of cartilages. I will show that to you in a moment. And there is a ground substance, chemicals, and here the chemicals, the main chemical is called chondroitin sulfate. Probably you have heard of this chemical before, chondroitin sulfate. Sometimes you will find it in the boxes of supplements that you find them in shops. So they use it to replace the worn and torn cartilage, chondroitin sulfate. The difference here in cartilage, between cartilage and connective tissue proper, is that it is avascular. Usually connective tissue is highly vascular. We mentioned that previously. We said that like in the dermis, for example, the blood supply of the dermis is important for the overlying epidermis, which is epithelium. And so this one lacks blood vessels, and not only blood vessels, but it lacks the nerves. The nerves and blood vessels are only are only present in a fibrous tissue, a dense, irregular fibrous tissue that covers the cartilage and called perichondrium. So this perichondrium covers the cartilage, not all the cartilages. So like for example, articular cartilages at the site of articulation, they are not covered by the perichondrium. So the cartilage, according to this structure, the cartilage is resilient, can endure more stress than the loose or dense connective tissue. As I mentioned, that there are different types of fibers in the cartilage. So it's either hyaline cartilage when it contains thin collagen fibers, or it is a fibrocartilage when it contains thick bundles of collagen fibers, or it is elastic cartilage when it contains elastic fibers predominantly. So therefore we have three types of cartilage. Let's start with the first type of cartilage, and this is the hyaline cartilage. This is the most abundant type of cartilage in the body. Hyaline means glassy because under the microscope you will not be able to see the fibers in the ground substance. The fibers are thin and tiny, so it looks like glass, transparent glass. So that's why it's called hyaline. In fact, most of the skeletal system in the embryo and the fetus is in the form of cartilage, as I will show that to you. Most of the skeleton, I cannot say all, but most of the skeleton starts as a template of cartilage, of hyaline cartilage, that later on will change into bone. So that's why it's abundant in the fetus. Also in the adult, it is present in several locations. So it is present like in the rings, C-shaped rings of the trachea to make them patent, always open. We need the trachea always open for inhalation. Also, it is present in the nose, hyaline cartilage, the movable part of the nose for protection. And also, mainly, it is present in the body as articular cartilage. So the articular surfaces of joints where the bone here has smooth areas, and these are covered by cartilage. The cartilage is called articular cartilage because it is present in a joint, in an articulation. Most of it, not all of, is hyaline cartilage. So it provides a smooth surface to reduce friction, and at the same time, it is, as I said, it endures stress more than even the dense connective tissue. So that's why it is there in the cartilage, to reduce the stresses and to reduce the friction. Unfortunately, this cartilage, I would like to remind you, it is avascular and it does not have nerve supply. So with aging process, with the wear and tear that takes place in the cartilage in the joint, then this will result in destruction of the cartilage. The patient, this is called osteoarthritis or osteoarthrosis, but the problem is that the patient is unaware of it until the destruction reaches the bone, which is sensitive. So at that point, the damage in the cartilage is extensive. And again, unfortunately, the cartilage is not easily repaired because it doesn't have blood vessels. If it has blood vessels, then it would be easily repaired, no problem. Okay? So again, I repeat, cartilage does not have vessels, does not have nerves. The second type of cartilage is called fibrocartilage, and as the name indicates, it contains a lot of collagen fibers. It looks like a dense, regular connective tissue. A lot of collagen fibers, but here, in between the collagen fibers, it is not only fibroblasts, but there are lacunae of cartilage, of chondrocytes. There are chondrocytes as well. Okay, so you expect that this cartilage is very strong. Not hard, but it is strong, and so it is used, for example, it is located in the intervertebral disc between the vertebrae, where most of the weight of the body has to be transmitted in the intervertebral. We'll talk about it in the joints. In some of the joints of the body, like in the knee joint here, the fibrocartilage, in addition to the hyaline cartilage that covers the articular surface, some of the joints, like the knee joint as an example, you see it here, there is another cartilage within the joint cavity. So, and this is fibrocartilage. There is one also in the temporomandibular joint. Fibrocartilage is present in the symphysis pubis. So it is present in several places in the body, but it is not the predominant type of cartilage. It causes rigidity and strength because of the fibers, the bundles, thick bundles of collagen fibers that it has. Now, the other type of cartilage, the third and last type of cartilage, is the elastic cartilage, and it contains a network of elastic fibers. Probably I mentioned that before. It is, for example, present in the cartilage of the auricle of the ear. so that when the cartilage is deformed, it can return back to its original shape. Of course, this is not that important, the presence of cartilage in the auricle of the ear. So the auricle of the ear is elastic cartilage, just to remind you, because sometimes there are tricky questions. So this is elastic cartilage, but this one is hyaline cartilage, and the nose is hyaline cartilage. But the most important elastic cartilage in the body is present at the beginning of the respiratory and digestive passages, and it is called the epiglottis. We're going to study this cartilage later on. It is leaf-shaped cartilage. Leaf-shaped, I mean, it looks like this, like a leaf of a tree, okay? So if you look at it from the anterior side, if you look at it from profile, it will be like this, okay? And it will close, and then because it is elastic, it jumps back to open because it's elastic cartilage. And this happens all the time when we swallow. You can see it here. It's at the beginning of the larynx. So when you swallow, food and drink will pass over the cartilage. It will not pass into the larynx or the trachea because this is closed at that time. But immediately after swallowing, respiratory passages should always be kept patent. So once it's deformed, it can return back because of the elasticity that it has. So that's a very important cartilage here, the epiglottis. So far about the cartilage. So now I'm going to deal with the bone tissue. And the bone, as it's a connective tissue again, the same features of connective tissue, I mean, the essential components, cells, fibers, ground substance, matrix. And so it's a connective tissue. It supports the framework of the body. It protects, like the bones of the skull protect the brain. The vertebral column protects the spinal cord. The ribs, they protect the heart, they protect the lung. So it is for protection and assist in movements. So the bones and joints, they act as levers and fulcrums on which the muscles act to produce movement. So it's part of the lever system of the body. Storage of minerals, because there is here, the ground substance is not chondroitin sulfate. It contains calcium phosphate, calcium carbonate. So there's a lot of calcium phosphate that is stored in here and can be mobilized whenever the body requires it. So it can be mobilized. Also, it is for blood cell production, what we call hemopoiesis or hematopoiesis. Because inside the bone, there is bone marrow. And there are two types of bone marrow, actually. There's a red bone marrow, as its name indicates, it produces blood cells. And there's yellow bone marrow. And yellow because it has a lot of fatty tissue, fats. And so you expect that the yellow bone marrow is for the storage of fat. So it stores. If you look at the diagram here, you will find, like in the fetus and newly born, most of the bone marrow, if not all, is red bone marrow. And then after that, you will find that in the long bones of the body, mostly in the center is yellow bone marrow, and the red bone marrow is only present at the ends of the bone, where we have cancellous bone, as I will mention later on. Or it is present mainly, the red bone marrow, in the flat bones of the body. Okay? But not all of it is red. There is red and yellow bone marrow. Now, bones are classified according to the shape. So this is a classification. This is a gross anatomical classification of bone. So a bone could be a long bone. Not all the bones are long. But a long bone, by definition, means that it has a shaft, as you can see it here. There is a shaft and two distended ends. Okay, and the length of the bone is longer than the width of the bone. So this one, for example, is the humerus, is a long bone. Radius and ulna are long bones. The femur is a long bone. In fact, the femur is the longest bone in the body. But it's a long bone in the sense that it has two distended ends and a narrow shaft. Like, for example, here, the bones that are present in our fingers, okay, or even in the toes, they are called the phalanges. They are very short, but they are classified as long bones because it's not after the length of the bone. It's after the features of the bone, the characteristic of the long bone. Two distended ends and a narrow shaft, okay? So this is the long bone. Then we have short bones. They are like cube-shaped. They are short and cube-shaped for for example, here the bones of the carpal bones that are present in the wrist region, or the tarsal bones. We're going to study them later on when we deal with the axial skeleton. So these are short bones. And then we have flat bones. Like, for example, the sternum here, this is a flat bone. The bones of the calvaria of the skull are flat bones. Ribs are flat bones. Here, the iliac crest are flat bones. So they are flat and thin. And you will notice in a moment that if you cut the bone, you will find that it has two plates of what we call compact bone, and in between them there's a sandwich of spongy bone. I'll show that to you in a moment. Then we have irregular bone, irregular, complex shape like vertebrae, and then we have sesamoid bones. So sesamoid bones, the name sesamoid means that they look like sesame seeds, and also they are small. They are not as small as sesame seeds. They are a little bit bigger than sesame seeds. They are not always present, and if they are present in the tendons of muscles, and they change the direction of pull. They improve the leverage of the muscle, whatever. So they are present, and you cannot feel them. You can only discover them when you take an X-ray. So you'll find a small, tiny pebble or a sesame seed in the tendon of the muscle. But the biggest sesamoid bone in the body that we can all feel in front of our knee joint, you cannot do that if you are sitting. You have to extend your knee, and then you can move it right or left. It's called the patella or the kneecap. Okay, so this is, again, it is present in the tendon of this muscle in front of the thigh, the quadriceps femoris muscle. It's present in the tendon of this muscle. It's a sesamoid bone. It's always present, and it's the biggest sesamoid bone in the body. Others are unnamed. Usually they are unnamed, except one, which is called the fibella. Now, the long bone has different areas, multiple areas here. So the distended ends of the long bone are called the epiphyses, and then the shaft or the body of the bone is called the diaphysis, and in between the shaft, in between the epiphyses and the diaphysis, there is an area here which is called the metaphysis, and this contains a plate of cartilage. I'm going to talk about it in a moment, which is called the epiphyseal cartilage plate. So this is a plate of cartilage located in between them, and then it will disappear later on. Like, you don't find it, for example, in this bone. This is a bone of a person who is more than 21 years of age, because they disappear. It is here where the bone grows, and the bones will stop growing, and there's no more growth in bones after 21 years of age. Of course, some of the bones, they will stop growing at 15 or 16, but after 21, there's no bone that's going to continue to grow in length, but bones can grow in width as well. And then we have the articular surfaces of bones, like, for example, this is the humerus. So this is an articular surface, smooth surface, and it's covered by hyaline cartilage, usually covered by hyaline cartilage, called articular cartilage. Here they articulate with the radius and ulna, and again they are covered with cartilage, articular cartilage. And as I said, it acts to reduce friction and it reduces the stress, so they act as shock absorbers as well. There's a cavity in the bone, in the shaft of the bone, in the diaphysis, which is called the medullary cavity, and this contains bone marrow. Usually this bone marrow in adult life, it is yellow bone marrow, usually, because the red bone marrow will be present between these plates of bone, the spongy bone, that are present at the ends of the epiphyses and the metaphyses of the long bone, contain red bone marrow. And the medullary cavity is lined with what we call a layer of cells which constitute an endosteum, endo, inside, osteum, os means bone. And then the whole bone is covered by periosteum, like perichondrium. Here again we have periosteum, which is connective tissue, but it contains nerves and vessels like the perichondrium, and in addition to that, it contains layers of bone-forming cells. So these will help in repair and the growth of bone. There are bone-forming cells. So I'm going to talk about the cells of the bone in a moment. So this is the anatomy of the long bone. Bones can be compact or dense or cortical. It's the same. Compact, dense, or cortical. Obviously, this is a compact bone. You cannot see any spaces. And you can see that it is very thick here in the shaft, but also it is present in the outer part of this area. So it is cortical. It forms the cortex, the outer part of all bones, including the flat bones. This is what I mentioned about flat bones before. I said that there are two plates of compact bone. This is one. Here's the other one. Here's the second one. And in between them, there is a sponge. There is a spongy bone, the second type of bone. And this is the second type of bone, which is spongy. It is trabecular or cancellous bone. So two types of bone, grossly speaking. Again, the spongy bone, it's like a network or a lattice work of thin plates, trabeculae. Trabecula means plates. So it's thin plates. And these thin plates, they have different orientations. If you look closely, for example, at this head of the femur, you'll see that there are like arches. They are oriented in arches, and they are usually oriented in line with the forces that are applied to the bone. So the force comes from the tip of the head of the femur. This is the body weight, and has to be transmitted like this through the neck and then goes down to the shaft. So that's why they are in the form of arches, these trabeculae. And in between them, the spaces in between them are stuffed with red bone marrow. No yellow bone marrow here. The yellow bone marrow is present in the shaft, in the medullary cavity of the bone. It is present only here, in this medullary cavity. Okay, but here it is all red bone marrow. So usually it is found in the ends of long bones and inside flat bones, this is inside the flat bone. And the cells are not arranged in osteons. Okay, so just take this sentence now. I'm going to talk about it in a moment. The cells or the tissue, if you look at it under the microscope, it is not in the forms of osteons. So what are the osteons? Let's go to the histology of the bone. So it's a connective tissue. It has cells, it has matrix, and it has fibers. And so the matrix here contains collagen fibers, as well as crystallized minerals, calcium phosphate, calcium carbonate. And you can see here, the cells are widely separated from each other. This is a cell. Here is a cell. Here's another one. And again, these cells are present in small lakes. Remember, lacunae. And they are imprisoned there, these cells. And these are called osteocytes. Okay, not chondrocytes. Chondro for cartilage, for bone, it is osteocytes. So the presence of collagen fibers and the presence of the crystals of minerals in the matrix will give the matrix some characteristics. So when the collagen fibers, the collagen fibers are for the elasticity. So when the collagen fibers are lost, like what we see in the skeletons in the lab, dried bones in the lab, the bone will become so brittle, easily broken, because it doesn't have collagen fibers. Collagen is a protein, so it will be lost after death. And if these minerals are reduced, then the bone will become soft and pliable, like what happens in cases of osteomalacia, for example. When there is reduced minerals in the body, you can see that the bone can be folded even without breaking. Okay, but usually there is a balance between the two. Each one of them will give a physical characteristic to the bone. And then we have the cells, 4 types of cells. There's one cell which is called osteoprogenitor cells. As its name indicates, it's present in the periosteum, it is present in the endosteum that lines the bone, and it can multiply and produce the osteoblast, and the osteoblast will produce the osteocyte. And so it can multiply. It produces other osteoprogenitor cells and produces osteoblasts. And then the osteoblast will lay down the matrix of the bone, become imprisoned inside the matrix. It doesn't multiply. So this one multiplies. This one lays down the matrix but does not multiply. Once it lays down the matrix, it becomes imprisoned in that surrounding matrix and become an osteocyte. Here, the osteocyte cannot lay down the matrix, can only maintain it, and it cannot multiply. So it is just sitting there in that small lake, in the lacuna. So these cells, as the name osteoblast, it builds because it lays down the matrix, it is building the bone. So blasts are for building, and then we have the other type of cell, which is unrelated to them. It's called osteoclast. So the osteoclast destroys the bone. It carves the bone, C for C, osteoclast and carving the bone. And it's actually like a macrophage. In fact, it's a macrophage. It originates from the bone marrow. So it does not originate from this lineage here. It originates from the bone marrow. And the macrophages, they are large cells, as we mentioned, that phagocytize. But this one actually is a combination of macrophages. So you can imagine that it's very large cell, and even has, look at it here, 1, 2, 3, 4, 5 nuclei probably, because 5 macrophages came together and formed this giant cell. And it's filled with lysosomes, filled with vesicles that contain digestive enzymes that are going to be released and digest the bone, the surrounding bone. Digest it not in the sense of killing it, but in the sense of reshaping it, because the bone, although it looks hard, but it is alive. It is constantly building and reshaping itself. And this is done by the osteoblasts and the osteoclasts. So always we have a balance here. So this is the osteon. Remember I said that the spongy bone has no osteons, but the compact bone has osteons. So this is the osteon. It's concentric rings of bone. It looks like the growth rings of a tree. So you can see that there are concentric rings here of lamellae, of calcified matrix, and they surround something. They surround a canal. And this canal is, in fact, it is vertically oriented. But it looks circular here because it is cut in section. But the canal is vertical, and these rings are surrounding it like this. So this is called the Haversian canal, and it contains blood vessels. So there's blood coming here. There's a lot of blood even reaching the center of the osteon. Okay, and then you can see that the osteocytes are imprisoned here in the small lakes, in the lacunae. Look at it here. And not only they are imprisoned, they not only just sit there, but they have processes. So they pass through small canals, which are called canaliculi, and connect with adjacent cells and with the Haversian canal, so that nutrients and waste products from these cells can be exchanged. So all of them, they have processes that connect with other cells, connect with the blood vessels. They are living, viable.
This arrangement of osteon is not present in the spongy or cancellous bone, but it doesn't mean that the spongy bone does not have osteocytes.
Here, lying in lacunae, and there are osteoclasts, look at this large one, and osteoblasts, there's matrix, but there is no central canal. And the reason is obvious here, because these are very thin plates, and they are surrounded by the blood, which is present in the bone marrow. So they don't need this intricate and complicated system of blood supply, which you can see it here. See, this is in the compact bone. There are multiple Haversian canals, and then surrounded by the osteons. Obviously, not all of the compact bone is in the form of circles, because you cannot put all the circles together. Definitely there will be some spaces between the circles, like this space and this space, and they are also filled with bone. So you can see there's bone here, there's bone there, there's bone here, but these are not in the form of osteons. We call them interstitial lamellae. So the interstitial lamellae, they just fill or stuff the spaces between the osteons, and they represent probably they represent the osteons that have been old osteons that are destroyed, and now they are replaced by new osteons. This is just to show you that sometimes they give radioactive material and they do what we call a bone scan. And in tumors of the bone, there will be a lot of blood supply in the tumor, because this is to emphasize that the bone has a lot of blood supply, and when it is has a tumor, there is increase in the amount of blood supply. So you can see like hot area, more of the radioactive material in cases of cancer. But when the bone is infected, then you don't see that much blood supply in the area where the bone is infected. This is called bone scan. This is just to show you that the difference in the blood supply of the bone. Now, this is an important subject to keep it in mind, is the bone formation or ossification. As we mentioned, all embryonic tissue that was mentioned earlier arises from mesenchyme. So here we have mesenchyme. These are large irregular mesenchymal cells, and these mesenchymal cells either change into osteoblasts, and this is what we call intramembranous bone formation. So they immediately change into bone, or the other option, which is most of the bones of the body, they change into chondroblasts. So they change into a template of cartilage, and then this template of cartilage will be replaced by bone. And this cartilage is hyaline cartilage. Remember I mentioned that it's present in the fetus, the hyaline cartilage as well. So there are two types, either endochondral ossification, which means that it changes, mesenchyme becomes cartilage and then bone, or it is immediately intramembranous ossification. The intramembranous ossification usually takes place in bones that you need them rapidly, bones that protect. So that's why they are present, the intramembranous ossification, usually it is in the bones of the skull, flat bones of the skull. Usually they are flat bones of the skull, in the sternum, in the ribs. These are intramembranous ossification. But most of the long bones of the body, they are endochondral ossification. You can see here what I have just said, that they will form spongy bone in the middle, and then there is compact bone here, and usually then they will be infiltrated with blood vessels and so on. In endochondral bone formation, as I said, mesenchymal cells become chondroblasts, and chondroblasts form hyaline cartilage model or template for the bone, and then there will be this template. It's a cartilage, so it doesn't need blood supply, but it will be invaded by a blood vessel, nutrient artery, and this is to calcify the cartilage, to lay down calcified tissue, and then will bring the osteoprogenitor cells and will change the cartilage into bone. And so this is what we call it a primary ossification center. Usually it starts in the shaft of the bone, in the diaphysis, the primary ossification center, and then other ossification centers appear at the end of the bones, at the end of the long bones. So at birth, all the long bones in the body, I'm not saying all bones, but all the long bones in the body, they have their primary ossification centers, and then they will start to have secondary ossification centers at the end of the long bone. And that's how there will be between the primary ossification center, which is present in this is an X-ray, so between the primary ossification center, which is present in the shaft of the bone, and secondary ossification center, which is present in the epiphysis of the bone, there will be a growth plate, a plate of cartilage that is laying down cartilage, calcifying it and changing it into bone, putting another lamina, and the bone is increasing in length. So this is the growth plate. If you take an X-ray, then you will find that there is nothing here. It's empty, because in an X-ray, the cartilage, we call it radiolucent, but bone is radio-opaque. So the bone appears whitish, depending on the thickness of the bone, while this is called, in radiology jargon, it is called radio-opaque, and this is called radiolucent. It is not empty, there is no air here, but there is cartilage plates. And you can see here, there is a joint. This is a bone, this is another bone. Again, there is no air here inside the joint. But why don't we see anything in the X-ray? Because there are articular cartilages covering the two adjacent bones. So the two adjacent bones have articular cartilages. These are not shown in the X-ray, so it appears as if the joint is an empty joint, but in fact it's not. There is cartilage. So there's cartilage here, which is articular cartilage. There's a cartilage here, which is growth cartilage. We call it epiphyseal cartilage plates because it is in the form of a plate, and this continuously lays down bone, and the bone increases in length until we reach the age of 21, and so all these are closed. Closed means that they are ossified. No more cartilage, no more laying down of cartilage and changing into bone. As you can see it here, it is ossified, and there's only a small tiny line remaining here, which is a newly formed bone. That's it. It is the epiphyseal cartilage plates are closed. So this is how the bone grows in length. Also, the bone grows in width, and this is a process between osteoblasts and osteoclasts. So the osteoblasts in the periosteum are laying down bone, and the osteoclasts in the endosteum, which lines the medullary cavity, is eating the bone, and so the bone increases in width. And here, this is another process where bone remodeling takes place. In orthodontics, when you use the pressure of the braces, so they will press on the tooth in its socket. So where there is pressure on the bone, which is the socket of the tooth, then osteoclasts are going to act, destroy the bone. Osteoblasts build the bone on the other side, and this will result in aligning of the tooth. Of course, this process takes a long time. Same thing like what happens, for example, in fracture of the bone. When the bone is broken, then osteoclasts will first come in, remove the jagged pieces of bone, and start to lay down new bone. And the new bone, actually, which is laid down after fracture, will be excessively, more than what we need. So this results in like a lump in between the two bones, and then this will be carved away, removed, and the traces of the fracture will be lost. Blood supply and nerve supply. I mentioned that has a very good blood supply, and it has a good nerve supply, but the nerve supply is only in the periosteum. No sensory nerves, let's say, enter inside the bone, but the blood vessels enter inside the bone. That's why when you do a bone biopsy, when you want to take bone marrow from the bone marrow biopsy, you have to pass a trocar or a needle, a wide bore needle has to be passed. You can see it here. When it penetrates the periosteum, that will be painful. After it penetrates the periosteum, there is no more pain because it's only the periosteum that is sensitive to pain. This is to show you the effect of aging on the bone. There is demineralization, which is actually, it is more prominent in females after menopause for hormonal reasons. I'm not going to go into details. And also there is reduction in collagen fibers.